Resilience has been an extremely popular and important topic these days. Most Americans, children and adults alike, are facing many new challenges, from remote and blended learning, fear and anxiety about returning to school and the workplace, increased awareness of systemic racism and divisiveness in our society, to name a few. We know we need resilience today more than ever, but what is it, and how do we build it? Hi, I'm Stuart Lustig, Senior Medical Director and Board-Certified Child and Adolescent Psychiatrist with Cigna. Resilience, or our ability to quickly recover from challenges, is a quality that exists in all of us. In our most recent survey, using the Cigna Resilience Index, we studied resilience levels in children, their parents, and young adults. What we've learned is quite remarkable. We found a resilience curve that shows us resilience is most prevalent in young children, but as kids move through adolescence, they experience a sharp drop in resilience. But we also saw that resilience levels rise back up as young adults start their own families and become parents. So what does this mean for our families and for our communities? Children and young adults are dealing with a lot, and the outside world weighs heavily on our kids, today more so than ever. More than half of the parents we surveyed said COVID-19 is causing their child to experience stress and anxiety. Research shows that if we can help children build and practice resilience from a young age, we can reduce the resilience drop that occurs between the ages of 18 and 23 and help them on a positive trajectory for the rest of their lives. Adults, parents, teachers, coaches, community leaders all play a critical role in helping children through these most formative years so that they can cope and grow through challenges. Resilience is an important quality that in children is connected with physical and mental health, stress and anxiety levels, feelings of self-worth and self-esteem, and academic aspirations and achievement. Simply put, more resilient kids are more likely to be healthy and feel confident about reaching their potential. Fortunately, there are many ways that we as adults can help kids build resilience. Encourage them to stay active. Spend quality time together as a family. Have them seek out a mentor. Expose kids to diversity at school and in your community, and help kids be inclusive of others and treat each other fairly. It's also important for parents to focus on their own levels of resilience, as resilient adults tend to have more resilient kids. At Cigna, we focus on whole person health, treating both body and mind as one. We are committed to helping people be the healthiest versions of themselves, which means being able to cope and get through the challenges we're facing. This is why we've launched Grow Forth, Cigna's action plan to build greater resilience, knowing that resilience is a lifelong skill and something that is in each of us. We're helping people to grow so that each of us can face life's challenges and come out stronger. Small actions can make a big difference, like writing down your ideal outcome, committing to one thing you can tackle today, accessing resources, and remembering that asking for help is a sign of strength.